My name's Lisa Nissen. I'm the Head of School of Clinical Sciences here at the Faculty of Health at QUT. In the case of UTI, we're looking specifically at women between 18 and 65, being able to have faster access and easier access to medicines to treat UTIs in the community, where access to general practice services and faster treatment will improve outcomes for the condition. For women in this case, it's something that you need now. If you do have the symptoms of a UTI and you do have a UTI, you want relief from that and treatment for that quickly. And if you are in a situation where you have a delay seeking any kind of medical treatment, you've got a couple of days before you can get into the GP, or even more than 24 hours to get into a GP, you're starting to talk about something that's very uncomfortable. It's affecting people's quality of life, it's affecting their personal interactions and their personal life. Why not deal with it much faster, much more effective? It's really as you start to move into your early adulthood and your middle age bracket that you will find the conditions will lend themselves more to presentations of UTI. So things like increased sexual activity, issues around general heat and hygiene, other types of things that might increase the likelihood that you may get a bacterial contamination that might need treatment. And that really is age related. And as you start to get a little bit older, maybe my age, it starts to be a little bit more dependent on some of your change of life hormone issues as well, maybe put you at a greater risk of having a UTI. The complication risk is that if you don't treat it and you get the bacterial infection spreading, you could end up with some infection in your kidneys, which is a much more serious infection, because your kidneys are really the filtering system for your body and you want them functioning as best as possible. Antibiotic treatment will certainly help resolve the symptoms very quickly, and usually within 24 hours you will see benefits from antibiotic treatment. I think in regional and rural areas where access generally to general practices and even hospital or any kind of clinical facilities may be harder, they will be the types of people that will benefit the most. The diagnosis question, or the D word, comes up all the time, but pharmacists do diagnose within their scope of practice. So I'm not going to diagnose, leukemia in a small child, but I would be able to diagnose that you've got an upper respiratory tract infection that's a virus that needs symptomatic treatment. The big picture of this is that the pharmacy workforce is very accessible. There's 3,500 plus pharmacists in Queensland dotted everywhere, really highly trained health professionals, and it seems a waste not to be using them to help improve access to healthcare in the community. If we can use pharmacists to the best of their ability to improve healthcare in the community, why wouldn't we do it?